Welcome to this episode of Heart-Led Hustle. In today's episode, I want to break down this concept of trauma-informed care, looking at what that phrase actually means and the importance of integrating it into our work, into our marketing, and into the way that we hold space for others, regardless of what industry you are in. In this episode, we are going to break down exactly what that phrase means, as well as identify how it can show up in the spaces that you hold with your clients during sessions, however they may look. I'm also going to cover a few different ways that trauma can show up in the room and how to ultimately create spaces that are designed for safety to reduce the risk of re-traumatization or to avoid triggering our clients or potential clients in any sort of space that we may hold, okay? So this is for you if you are someone who works with people, okay? One of the things I really want to, debunk is this idea that trauma-informed care or trauma-informed practices or to be trauma-informed means that you treat trauma. It does not mean that you treat trauma unless you are trained to treat trauma, right? Trauma-informed care means that you are trained and aware of what trauma is, and more importantly, the way that it manifests in human beings by the way of behaviors, thoughts, emotions, nonverbal cues, right? And ultimately, it teaches you how to maintain a sense of safety so that a person is not re-traumatized under your care. Okay, so it's not about treating trauma, it is about creating a safe space. Now, because of this definition, I want to pose it to you that it's so important to consider whether or not your practice, your business is trauma-informed, right? If you work with people in a capacity whereby they are vulnerable with you, where they are sharing stories with you, where maybe there are emotions that come into the space where the professional relationship lies, then I would invite you to seriously consider becoming trauma-informed. So this includes not only therapists, like I said before, but all types of coaches, right? You could be a fitness coach, you could be a relationship coach, you could be a mindset coach, a business coach, right? Knowing that business is such a self-development journey in of itself, super important to be trauma-informed, right? If you are a doctor, right? I've worked with many different doctors in my practice, and I can tell you from what they have said to me that they don't receive this type of training in their standard education that they go through, and that to become trauma-informed, to understand what to look for in their patients when they are treating them or helping them with the diagnoses is something that creates such a different felt sense of safety in the room. And I'm sure you, as a person who's probably been to the doctor, knows the difference or can feel the difference between someone who genuinely cares about you and your safety versus someone who sees you as a diagnosis, right? Very, very different experience. So doctors should absolutely be trauma-informed. But here's the thing. So should personal trainers. How many times have you had a personal trainer whereby, you end up telling them everything that's going on in your life? You tell them about what's happening in your marriage. You tell them what's happening when you went out last night, how, this happened and that happened, and the breakup you're having with your boyfriend or your friend, or how much you hate your boss or whatever it might be, right? These people by default become safe spaces in our lives. Another one is your hairdresser. How many times do you divulge everything that's going on in your life to your hairdresser, right? So thinking about humans who work with humans. Another one that comes to mind because of my own background in this space is HR managers. HR managers, anyone who works with organizational behavior, anybody who works with employees directly, helping them through their succession plan, helping them with their performance reviews, helping to audit their work, helping to look at efficiencies, right? It's really important that these people are trauma informed. So if you fall into any of those categories, or if you're nodding along and you're saying to yourself, like, yes, I do work with people, and I do work with people who share, intimate parts of their life with me, then this episode is for you. So let's dive down, okay? Let's dive in. So Trauma-informed care is an approach that recognizes the prevalence of trauma, and it integrates practices that prioritize safety, trust, and empowerment. Now, something that I often share in my own, work with my mentees and with the students that I teach within our trauma-informed coaching certification is that, and this is just my own kind of theory around this, but it helps us to understand a little bit. When someone has experienced trauma, a lot of the times what we notice is what I like to call the 3 Ds, right? So we have disconnection from themselves or from the world around them. We have dysregulation of their nervous system, whereby their nervous system state might be stuck in a particular state due to the trauma. So we have dysregulation, disconnection, and disempowerment. So usually that feeling of shame, the emotion of shame that takes over due to trauma, or the feelings of insecurity and indecisiveness that a person can experience, that feeling of being small, of losing my sense of power, my sense of agency, my sense of authority, right? So disconnection, dysregulation, and disempowerment are often the things that people experience when they have experienced trauma, right? And I know that if you're listening to this and you have experienced trauma yourself, whereby that be complex or chronic or acute, you probably can identify with these 3 Ds in different ways. So when did you feel disconnected from yourself? When did you feel disconnected from the people who love you? When did you feel disconnected from the world around you, e.g. a lack of trust, right? Where in your life are you dysregulated, or where are you often triggered and you look back and you go, wow, why did I react like that to that thing, right? And then where do you feel a sense of disempowerment? Maybe you have a belief that your voice doesn't matter. Maybe you feel shaky before you share your opinion at the table. Maybe you can't make a decision. Maybe you feel really disempowered in your sense of agency or in your ability to set boundaries, okay? These are all very subtle ways that trauma can show up in the room and show up in our day-to-day lives. So when we are looking at the core principles of trauma-informed care, we want to really ensure that we are creating a space of safety first and foremost, right? And this isn't just physical safety if you're in the room with another person, but it's psychological and emotional safety. And this is done through the way that you attune with the person in front of you. For that person to feel truly safe in your presence, there are certain micro skills that need to be learned and need to be understood in order for a person to see the person sitting in front of them as a human being that has a past that they are not privy to, right? We often make assumptions as humans when we meet other people. We assume that they are confident, or we assume like, oh, they're extroverted, so like they must be fine, or whatever it might be. Now, I want to pose this to you as a therapist and as someone who has worked for many, many years in the space of trauma, in addiction, in recovery, eating disorders. I've, worked very much and studied a lot in this space. I teach this work to fellow space holders, coaches, social workers, etc. Is that a person, their personality is by, in many ways, it's an accumulation of defense mechanisms and coping strategies that they have learned throughout their life that teaches them how they should fit in to society, or how they believe they should belong in society and therefore be safe and attached to the people in the world around them. So even if you have someone who is seemingly very confident and very extroverted, that might be in itself a coping mechanism, right? You don't know, because you don't know that person's past. You don't know that person. So trauma-informed care ensures that you are not coming into a room with biases and judgments and assumptions. You're not judging a book by its cover, but rather you're meeting a person with the respect that they deserve, to see them as inherently worthy, and to be able to offer them what we might call unconditional positive regard in that moment, to really be able to say, okay, right, I see you as a human being who is so deserving of compassion, someone who is deserving of respect, someone who's deserving of acceptance, and someone who is worthy. And with that comes, like I said earlier, these micro skills that help a person to feel attuned to and safe. So this could look like, right, giving people choice, right? Which so many people don't do. They just say, this is what you have to do, instead of saying, hey, here are the options. What would you like to do, right? Informed consent. ensuring that people are fully aware of whatever work you're about to do with them, or whatever the system or the session or the meeting is going to entail, right? It looks like the tone of voice that you use, your body language, your nonverbal cues, a respect for their culture, a respect for maybe their religion, a respect for, who they are and how they show up, and ensuring that you can meet a person where they are at in order for them to feel safe in your presence, right? Trauma-informed care is something that needs to bring about a feeling of trustworthiness and transparency. So what does that look like in business, right? If I'm being trustworthy and transparent, it means I'm not being coercive. I'm not being manipulative. I'm saying and acting, my actions align with my words, right? So if you look at this in the greater scope of marketing, for example, like where are people hiding their prices? Where are people trying to be really coercive and manipulative in the way that they sell someone into their courses or programs? Where are people not being genuinely authentic? Where are we trying to lead someone on in order to just get a quick sale, right? Now, I can tell you as an example, in the past month, I've said no to 5 different potential client and student opportunities because it wasn't aligned for them. And I'm not going to have someone in my space for the sake of a quick sale. I'm not going to say yes to somebody just because they want to join my program when the program's not right for them for whatever reason, right? You want to definitely be transparent and trustworthy in order to maintain trauma-informed care principles. One of the things, like we said earlier, is this disconnection that happens as a result of trauma. A lot of the times people don't trust other people, and they don't trust them because they are manipulative, they are coercive, they are hiding things. Marketing is based off manipulation, right? It is based off understanding psychology and then manipulating, using that knowledge as a way to manipulate people, to make them feel a sense of urgency or scarcity in what they need. It's speaking to people's pain points. It's not fueling them with hope, but rather making them feel like if they don't have this thing, something is wrong with them, or they're going to lose out on something as a result. And ethical marketing and trauma-informed marketing is a skill in of itself, okay? Another principle of trauma-informed care is this feeling of collaboration. So if you're thinking about it from a coaching perspective or a therapy perspective, you're not the fixer. You are not the guru. You are not the person who is here to tell the other person what to do. You are not greater than anybody. You are a human just like the person sitting in front of you, and you're co-creating a space. You're co-creating and collaborating, and they are actually leading the way, not you. Right? They are the person who sought you out for coaching. They're the person who sought you out for therapy. It's not up to you to tell them what's wrong with them. It's not up to you to dictate how they should or should not live their life, right? It's up to you to learn how to ask the right questions to create a safe space whereby they can become a witness of their own lives and they can realize their own potential. Super important. And there's a big difference between being a guide and being a fixer, okay? Empowerment, voice, and choice. We kind of spoke about this before, but enabling a person to feel like they have the ability and the freedom to make their own choices, to share their opinions without judgment, to have a safe space where they can question something without feeling like an idiot, right? So it's up to us to provide those spaces and to ensure that our clients or our staff, our employees, our patients, whatever they may be, that they feel a sense of empowerment, because that in itself is healing, right? Like I said earlier, cultural, historical, and gender sensitivity are things that really play a big role in trauma-informed care as well as understanding not only the fact that like generationally trauma has impacted on gender, cultural, and historical experiences in people's lives, but also that it's continuing to be perpetuated in our modern environment, right? So microaggressions are still existing every single day. And we might be in a position of privilege, but somebody else may not be. And it's not up to us to judge their experience. We don't know what their life is like. We can't make an assumption that just because life feels all easy breezy for me, that it feels like that for somebody else, okay? So these are some of the core principles, right? If you're thinking about it in practice, let's say you have a trauma-informed yoga teacher or trauma-informed yoga class versus a class that's not trauma-informed, right? A very simple difference between those two things would be that a trauma-informed yoga class offers options. It avoids forceful adjustments, the teacher always seeks permission and always encourages choice. There is never a you must do this, or you are not good at yoga unless you do this, or you have to engage in this activity otherwise you're not going to reach enlightenment. Like those types of force and pressure type experiences are what can re-traumatize a person and can make them feel like they don't have that sense of connection, empowerment, nervous system regulation that they are ultimately looking for. Now, the other thing I want to speak to is that to be trauma informed means that because you're acutely aware of what trauma is, right? So the first step is actually understanding what that word means, understanding that it is an experience that is allocated to the individual, not to you to determine, right? Somebody's experience of trauma or how somebody experienced a situation in their life or situations in their life has nothing to do with your assumption of how difficult that must have been for them. It has to do with the meaning that they attach to it and how they've interpreted that situation and how it's therefore impacted them throughout the rest of their lives. A big factor here is whether or not that person had any support whilst they were navigating through that trauma and how repetitive the trauma was. So as a first point, trauma-informed teachings help a person, a practitioner, a HR manager, a coach, whatever it might be, it helps you to actually understand this buzzword and to look at the different types of trauma that are out there, whether that be complex, chronic, acute, whether it be historical, collective, generational, medical, right? All the different types of trauma that are out there, and then how that actually impacts a person and what factors contribute and can contribute to it becoming traumatic for one person and not being traumatic for another. So what is the difference, right? Like, how come one person can go into a situation and come out of it traumatized and the other person not, right? So you need to understand the nuance between those two things. And then, like I said earlier, it's really about recognizing the symptoms of trauma through the way of behaviors, through the way of emotions, thoughts, memories, nonverbal cues, and then applying some of those core principles that I just worked through to ensure that you are meeting them with safety, and that if something does come up, you know how to actually not force or press on or push in any way, but you actually know how to hold that space with compassion. You actually know when is an appropriate time to take a pause, when is an appropriate time to check in with that person, when is an appropriate time to maybe seek permission to ask a question, when is the appropriate time to actually refer out, when is it appropriate time for you to know, like, hey, hang on a minute, this conversation's a little outside of my scope of practice. Like, how can I support you in finding the help that you need? Okay. Now, it's important here to understand that I would say everybody has experienced trauma to some extent, okay? Whether that be in childhood, whether it be later on in life. And once again, it's not up to us to say to a person like, oh, your trauma is bigger than yours, or your trauma is this or that, or whatever it might be. It's really learning how to meet someone where they're at and understanding that their experience is valid, okay? So people will show you, or their trauma symptoms, their coping mechanisms, their behaviors will show up in very subtle ways. And this is why being trauma informed is really important, because you become trained on how to pick up on those subtleties and how to ensure that person remains safe as a result. So recently I read an article about a lady in the UK, I believe, who's suing my words today, who is suing a yoga teacher. She went on a retreat, from my understanding of the article, went on a retreat with this yoga teacher in India, and they did some form of a psychological exercise on the retreat. I don't know what it was. The article didn't go into it. And this, what I'm sharing right now, is not to say anything bad about the yoga teacher by any means. I don't know how it all went down, but the point is that this woman did the exercise, and as a result, all of her trauma came up to the surface. It completely dysregulated her, and by what I understood, it then sent her into basically a whole she really fell apart as a result, and she kind of went on this really intense mental health journey as a result. She was completely dysregulated, she lost her sense of self, and she kind of pinpoints it to this experience that she had on this retreat. Now, once again, I don't know what happened, but if a person is in that situation and there is not informed consent. There is not a proper understanding of what the exercise is, what the potential consequences are, and the choice for someone to do it or to not do it. If there is not like the awareness of, hang on a minute, this is kind of going a little bit too far for this person, or this person seeming a little bit dysregulated, if there's not the support to help them regulate in the moment, if there is not the aftercare after an activity like that, if there is not a referral process after an activity like that, like all of these things create a sense of safety. And this article really showcases how aware people are nowadays of not only psychology and not only their own trauma, because so many people are talking about it. I mean, I work with a lot of teens and a lot of preteens, and these children, they have the lingo, they have the jargon, they know therapeutic terms, they are very aware of their own trauma because of what they're exposed to, what they're reading online, what they're seeing on social media, right? So it's really important that we as practitioners, space holders, doctors, managers, whatever it might be, that we can keep up with their level of knowledge and their level of awareness, and also therefore their needs. Whether we like it or not, people are waking up to themselves and their lives and their experiences, and they are needing a little bit more safety in their sensitivity, and it's up to us to be able to provide that for them, right? So when we're looking at trauma-informed care in coaching or business spaces, things that I would invite you to consider are like, are you being transparent with your pricing, or are you hiding it? Are you being transparent with your contracts, with your agreements? Are you actually stating everything out? Are you actually going through them with the person in front of you, or are you just getting them to sign on the dotted line without actually explaining what's in there, right? Are you using trauma-informed marketing strategies, or are you utilizing pressure tactics and pain point marketing in order to make a quick sale, okay? If you're in a group setting or a leadership group, for example, are you laying out what's going to be happening at the very start? Are you making sure that people are on board? Are you asking people if there's anything that's going to make them feel uncomfortable that day and adjusting accordingly? Are you offering opt-outs without shaming or judging people? Are you using mindful language instead of saying you must do this or you should do this? You can say things like, you might try, or I'd invite you to consider, or you could if it feels right for you, right? In customer experiences, we spoke about earlier marketing, but avoiding scarcity and urgency pressure in marketing, providing clear, accessible communication, being mindful of power dynamics or, assumed power dynamics by the other person, whereby that be cultural, religious, age, gender, whatever it might be. There are biases that exist out there that we have to be really, really mindful of. Now, a few things that I guess I hope that so far this has helped you in kind of understanding the importance of it. It's not something where we're wrapping people in bubble wrap and like being, I think sometimes people can have this thought of like, oh, everyone's so sensitive these days. Like, yeah, they are. They're more sensitive because they're more aware. And we have to move through this process of evolution of humanity where people are waking up. They are more aware. That is not a bad thing. It is a wonderful thing. But we have to know how to meet them where they're at rather than dismissing what they're feeling or what they're experiencing, because ultimately we have this opportunity to help them to heal by creating a greater sense of trust, connection, empowerment, regulation to help them to become the versions of themselves that they want to be, and or to seek the help and support that they're really needing at the time so that they can move through life feeling a lot safer within themselves and the world around them. Like, wouldn't that be a nice thing? And why wouldn't you want to get on board with that? Sorry, but I don't understand why somebody wouldn't want to, right? So I believe that all businesses, all organizations, from receptionist through to CEO, should be trauma informed because you're working with each other. Right? If you're not sure why Mary from accounting just got annoyed at blah, 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 right? Maybe if you had some awareness around it, you would. And maybe you could meet Mary's reaction with a little bit more compassion. It doesn't mean you need to agree with her behavior, but being trauma informed enables you to step into somebody else's shoes for a second instead of making everything about you, and being able to say, okay, hang on, what might be going on for them? What might be going on? What are they seeing in this moment? What lens are they wearing, right? Once again, it's not about always being agreeable. It's not about, having to sugarcoat everything. It's not about having to always agree with Mary, but it is something to say like, I understand. I understand, and instead of me adding fuel to this fire by me getting reactive, like how can I create a sense of safety here? Or how can I be a little bit accepting that we're all walking each other home, as Ram Dass famously said. We've all experienced trauma in some way, right? So how do I actually apply that skill of compassion towards other people and apply it into my business so that people feel safe and secure when they work with me and within my courses and programs? And if you are a space holder, if you're a therapist, a social worker, a coach of any sort, like I said, a personal trainer, a HR manager, if you're any of these people that hold a doctor and you hold space for others, this is so important because it's the difference between someone like wanting to see you, feeling safe with you, feeling safe to open up, referring you on to others, like all of these things, versus someone who's like, wow, that was like such a re-traumatizing or such a horrible experience because I just felt like that person didn't even see me. They didn't even see me. And if we are working in these spaces to try to make the world a better place, to try to help other people, then we absolutely want to make sure that our clients feel seen, heard, understood, and safe in our presence. And like I said at the very start, it's not about treating trauma. You're not sitting there and going into their childhood wounds with them and doing inner child healing if you're not trained in it. You are just noticing these cues, right? You're picking up, you're being able to offer compassion and empathy at a much greater level, and you have a level of knowledge and education that is empowering for you to be able to create spaces of safety for others, right? Now, a big part of obviously trauma-informed care is you, and you also doing this work. It's important that you can be a safe space for yourself, that you can meet yourself with these same principles so that when you do hold space for another person, like your ability to co-regulate with them is possible as well. You're not jumping into assumption. You're not getting triggered. You're not getting reactive for no reason. Like you're also working on yourself to be the safest person that you can be. So here's how you can kind of get started if you want to get started, right? And I've got a few different resources that you might want to look at to help you. So number one, I would say if you're really interested in this, educate yourself. That's the first place to start. Educate yourself. Read, train, learn about trauma-informed frameworks and how they apply to your industry and your business. If you are wanting to learn from me, I run a 6-month, 150-hour certificate in compassion-focused coaching that is designed for qualified coaches. It's designed for naturopaths, nutritionists, yoga teachers, space holders who wish to understand and become trauma-informed and apply a compassion-focused coaching framework to the way that they hold space with others. So this is in the show notes below if you would like to understand, okay? Audit your spaces. Ask yourself, is my client journey built on pressure or empowerment, right? Am I utilizing, like check your language. Am I shifting my language from directive, like you should, to invitational? You could, right? There's a big difference here. If you want some help with this, I've got a link below to an ethical trauma-informed marketing handbook. I think it's about 100 pages of different ways that you can apply trauma-informed marketing to your email sequences, to your landing pages, to the way that you communicate via email, to how you host your masterclasses, to how you create your programs, right? I help you to understand the difference in language and what kind of ethical marketing actually is when you look at it in practical action, right? You want to think about boundaries as safety measures. So clear contracts, expectations, and communication. So going through your business with a fine-tooth comb, are you actually addressing these things from the get-go? Are you just starting to work with somebody as soon as you've done a discovery call with them, for example, and you don't have a contract, you don't have a framework because you're just jumping straight into it? Maybe people do this because they don't like administration or they find this stuff is boring, and it can be boring, but it's really, really important, okay? So like I said, below you will find the link to our formal qualification training program, which is 150 hours. There is also a free 7-part video training that is designed for coaches, space holders, therapists, naturopaths, yoga teachers, etc. That is like a foundational framework of some of those core principles that I spoke about earlier. So it each video expands on it. There's some reflection questions there, and there's also like an 1.5-hour webinar training on how to safely hold space for clients when they do show up in a session with, maybe big emotions or uncomfortable feelings. So that's all for free. It's a 6 or 7 part video training that the link is below. Then there is the ethical marketing framework that you can also look at down below. It's something that I think it's like $5 or something like that. You can purchase that, and it's like a 100-page guidebook to really help you. One of my students actually has taken this PDF and she's uploaded it into her AI so that when she gets her AI to audit her landing pages, it audits it against that framework, and therefore she can always know that she is within the guidelines of trauma-informed language and copywriting when it comes to her marketing. So there's just a few different things for you to look at, a few different resources for you to have. I hope that you found this helpful. I hope that it has provided a little bit of food for thought. I can't stress enough how important this is, that you look at this, that you care, that you make the effort to create safe spaces, because this is how we change the world. This is how we help people to feel more seen, heard, and understood. This is how we reduce the risk of re-traumatization. This is how we create wonderful experiences, right? And this is how we can work collaboratively as, a population to really help those who are still struggling or still caught up in their trauma symptoms, to help them feel that sense of empowerment, of connection, and regulation once again in their lives. I hope you enjoyed today's episode. If you have any questions, obviously feel free to reach out.